Good. All right. Good afternoon, everyone. My name is Yue. I'm the fourth year student radiographer from University of Canberra. Today, I'm gonna give a presentation of post-prostate surgery cystogram case study, healing a bladder leak. All right. This case study explores the diagnostic journey of a patient who underwent a series of cystograms to monitor the healing of a post-surgical bladder leak. So I'm going to start to introduce what is the cystogram. So cystogram procedure, and then comes to introduce the patient history and the patient care in the 4 cystograms we did in specific. And then by analyzing the images and reports from the doctor, and we're gonna make a conclusion. Why cystogram is so important and how can I improve from that to make a perfect cystogram and eventually make the best optimize the patient care. All right, what is a cystogram? Cysto means bladder. A gram is a medical suffix. It's a Greek word, means a record or pictures. So cystogram means we're gonna grab pictures of a bladder, but how? So we're gonna use X-rays. To be specific, it's a fluoroscopy. So it's a kind of a dynamic real-time X-rays. But how can we see the bladders in the X-rays? So we're gonna use contrast dye to highlight the bladder in the pictures. Thus, we can use these pictures to evaluate the bladder cancer, bladder polyps, or vesical ureteral reflux. That means the urine make contact from the bladder to the ureter. It's kind of disease. But for our cystogram case study, it's a post-prostate surgical cystogram. So it's a little bit different. It's the main aim is to elevate if there is any leak on the bladder. Why we can use that to evaluate that? Let's go have a look at the anatomical structure of the prostate and the bladder. Look at the AP and lateral pictures. We can see the prostate just under all the bladder. So when the surgeon cut all the prostate out, there still be a chance we can cut the inferior border of the bladder. That's the reason why the cystogram is so important. If we doing the cystogram, there's no link, that means, oh, the surgeon is well done. He did a really good job. But even we found a leak in the bladder, it doesn't matter. The cystogram can guide the surgeon to make a treatment plan. And now for the normal cystogram procedure, it's very simple. So we're gonna put the patient on the bed, supine, radiologist put the catheter into the urethra, into the bladder. We'll give contrasting, the radiologist have pictures in what angles they like, or they're happy, they're done. And we get the catheter, remove the catheter, and we can send the patient away. But for our post-prostate surgery cystogram, we can do even more simple because they are, finished the surgery. The catheter already in their body. We don't have to do that. But actually, is that simple? Let's go have a look at our case study. So in my case, I have a 65-year-old male patient. So just undergo a radical prostatectomy, which means his prostate are removed during the procedure. That's the reason he popped up into our clinic, have the first time cystogram at 25th January to have the cystogram check if there is any leak on his bladder. But he came back in 2 weeks and another 2 weeks and then another 2 weeks, 3 times for a cystogram as well. So 4 times in total. What happened? Is there a leak or is there something wrong? Let's go have a look what exactly happened every time during the cystogram. So he popped up for 4 times. So every time it's gonna be a little bit different in some specific step in the cystogram procedure, but for most steps it's gonna be the same. I will figure out exactly what's the difference between that 4 in the specific procedure. Okay, now let's start. When we start one day start work, we pop into the workplace and we'll open our workplace, or we see a cystogram there. So what are we going to do? The first step, we're going to go into the screening room, start the setup. So we turn on the machine to make sure everything is working. It's nice and tidy workplace. Very well. Now we're going to start to set up our workstation for our tools and equipment. So what do we have for this cystogram? We're going to bring 100 ml contrast, a new one. It's just for display. Okay, a needle, a new needle, and the sterile gauze, a new one as well. 2 surgical clamps, and 1 catheter connector. We also call this Christmas tree. And this one is a infusion set. So this one gonna connect our contrast to the catheter. All right. So even before we start, we can connect the infusion set into our contrast. Oh, like that. So why we use the needle here? We just spike the needle into the contrast ball at edge as well. Because as we go, if we want the fluid to go down, we have to have some gas in. That's the reason we use the needle to set up this one. So we hang up in a higher place like that. Just to make sure this one, the button just roll to the bottom. And we're gonna have a test, just to move up a little bit to see if the fluid just coming out. If not, that means something wrong of the needle. We can change the needle to a thick one or just adjust the angle until we can see the fluid dropping out. If it's working very well, we can just close that and hang out there. Hold on, everything all set up. What are we going to do next? We're gonna go back, check the medical history of the patient. For the first time, we only have the referral from the surgeon. That's all the information we get. We go through the referral and we saw this patient just had a post-prostate surgery. Oh, that's the reason he come here. We're gonna check if there is any leak on his bladder. But for the second, third, and fourth time, except for the referral, we still have the previous cystogram pictures and report to go have a look as another referral to have a look. What happened for this patient? Why he come back again, or 3 times, or even 4 times? Or by through reading all the report and images, or we're gonna figure out, oh, that's the reason he come back again to check any leak. Is there any leak this time? Oh, good. All things is done. We just wait until we reach into the appointment time. Oh, patient is here. We just go out, bring the patient in. That's the first important step we need to pay attention to. We need to check patient details. So we need to double check name, address, date of birth, why you are here, to make sure we have the correct patient at the correct procedure. It's not also, you read that it's on the paper, the same one. We also need to double check is all the information is correct on the computer in our system. That's it. Everything is done, it's all correct. Is that patient? Oh, good. We're gonna ask him to change. We bring them to the changing queue, tell them everything off except underwear, put the gown on, make sure to open at the back. Oh, good. It's done. We bring the patient in the screening room. All right. That's the second important thing we need to do for every time to inquire consent. What consent we're gonna need? The first one, the consent about contrast use. Is it safe to use the contrast for this patient? Another one, the consent for to proceed the procedure. So every time they're gonna have a form for contrast consent form. So we go have a look at the first time. We noticed that he had a contrast dye injection before in the CT scan. Oh, and there's no allergy, no side effective reaction. Very good. So that means he probably have no issue for the contrast use this time. But we still need to use, go through all the questions on the form every time to double check he gonna have 100% safe use of contrast this time. If that's good, okay, we go to next step. We're gonna tell him what's gonna happen this time, especially explain very, everything is specific for the first time. It's gonna be good for the second, third time. You're gonna already know what happened, won't be freaking out. All right, if that's good, we're gonna ask him, are you happy to proceed your procedure? If we got yes, we're gonna start the cystogram. And then we're gonna lie him on the table, supinely. And now we're gonna connect our contrast into his catheter. All right. Now this is the patient catheter and catheter bag. There's a connection joint. So we're gonna use, first one, wear your gloves and clean your hand, wear your gloves. That's a Cleco clamp. We use one at the lower point at the joint. Another one on top. All right, so you make sure it's all locked. All right, now you can disconnect this part, but just be careful because this part connect to the patient body. We need to be gentle on the left side. So use your right side, give that more power. Wonderful, it's all out. Be careful when you putting down, don't touch on the table like me, okay? And then we'll open the gauze, make sure it's clean, nice and tidy, slightly. Just gradually open that. Make sure this sterile part in the middle of the gauze. Wonderful. And leave on the patient body. That body is on the mid of the femur of the patient in this area. We just leave on top of that. Make sure he is not moving. Wonderful. Now, we're gonna connect our contrast to that catheter. How can we do that? Actually, there should be a top there, but we just pretend. We turn off the top. When I open the Christmas tree, just open slightly. This part, we can touch. We won't use that. But the inside is sterile. Just be careful. You just touch that slightly. Also be careful, this part is sterile in part. So we just move a bit. Look at that. It's all sterile of the tip part. So we're gonna move up and put this part into the catheter slowly, but at the same time, make sure it's connected tightly, not leaking. When you're happy, good. It's all connected. So when doctor coming, if they want to start, they're gonna unclip the clamp and just go through that bottom up. The contrast gonna go through into the patient body, into the bladder straight away. All right, it's all connect, all good. What are we going to do next? So we're gonna have our prelim picture. That means just have no contrast X-ray pictures for the pelvis. So we're gonna put the bladder in the middle, make sure the collimation is in the optimal size. Well, it's all done. Now, what are we going to do? We're gonna go to see our doctors. Tell them we're ready for the procedure. So when the doctor come back to the room, they're ready, they put the gown on, everything is ready. We're gonna introduce our doctor to our patients. That's our doctor's job now. And he gonna start to inject the contrast and tell them, you feel full? I feel full, okay. They're gonna stop here and they're gonna come back to have some pictures of what he like. Usually doctors prefer to have supine one first, then left oblique, right oblique. Yeah, if he is happy, he gonna say, oh, well, okay, well done. And he gonna left, and that's now it's your job again to take over from everything in the room. And now, if there are two conditions left, if there's a leak happen, so we're gonna leave the catheter in the, no, stop. So before that, we need to just bring the bottle down on the floor. And we might just ask our patient to stand up for 5 minutes or 10 minutes. We're gonna ask the bladder to drain all the contrast down back to the original bottle. It might happen, might not happen, but we're gonna have another X-ray, we call it post X-ray. If 5 or 10 minutes, ask him going back, lying down on the bed again, just to have a picture to see if the bladder is clear, no contrast. If there's a leaking, we're gonna leave that catheter down. So what we're going to do, we just disconnect this stuff. Very tight. We're gonna throw that one in our clinical bin. All right, that's there. And we're gonna connect the urine bag back to the catheter. surround this demonstration. You shouldn't touch anything in the sterile place. But make sure this time it's all clamped on. And if it's all tight, you can just remove. Yeah, so that means the catheter gonna stay in patient body. So we're gonna tell them, okay, you need to come back, talk to your surgeon, there's a leak. You might come back again, something like that. But if it's clear, it indicates no leak. What are we going to do? We might call to the patient surgeon to double check, get the authority to remove the catheter from their body. Once it's approved, we're gonna go into our, nurse in place, ask our nurse help us to remove the catheter from the patient. And we're gonna say bye to our patient, tell him everything is all good. You're gonna have your report in 24 hours. That's it, that's all done. So that's all. After that, we discharge the patient. We're gonna start the post-processing of image, also make a record of the screening time, the screening dose of this cystogram. And then we're gonna start to clean up the room, and that's all done. But don't forget to scan all the signed consent form into your computer. That's all explained for the whole procedure. All right, let's go have a look what happened for what we found in all the images. These images from the left to the right is the supine bladder, left oblique, right oblique bladder. It's too small to go have a look. Let's zoom in to go have a look what happened exactly. That's the first time in 25th of January. This patient come in, have the cystogram. You can see the round right circle one is actually our his bladder. It's full up the contrast dye. And then we can see another bright side, but I use the right one to highlight that. It's the leak of contrast. Let's go have a look what happened in 2 weeks. That's the 2 weeks later. That's the yellow part. It's a leakage. We can see there's still a leakage there, but it's shrinking. How about another 2 weeks later? That's the green part. We can see it's still a little bit leak under the bladder, but it's more smaller. That means maybe the leak is healing. All right. Then it's come to the 4th time. Finally, what happened here? We can see there's no leaking, no contrast can detect under the bladder. It's only surgical clips around the prostate area. That means the leak is healing. Well done. Oh, good. Let's go have a look what our doctor wrote in their report. The first time, doctor said consistent with a leak. After 2 weeks, an ongoing leak, but it's decreased. And third time, it's albeit reduced, it's persistent leaking. And finally, the 4th time, it's completely healed. So what we detected from the picture, it's the same as our doctor write on their report. Good. So what I learned from these cystograms, or what makes a successful cystogram, it seems simple. But I think to reach a successful one, we need to focus on more details. Like the needles, I just done maybe 2 or 3 times. First time put the needle in, the contrast never come out straight away. So sometimes our doctor is really nice. They're gonna wait you for 5 minutes until all the contrast going through, but sometimes they are not. So you're gonna thinking about how to resolve your problem, like change the needle, maybe just squeeze this one for many times to help the contrast go in. That's the way I solve the problem. Also, for the gloves, sterile problems, yeah, I just have been advised twice. Just I have to wear gloves before I touch all the stuff for the patients. And also for the sterile part, especially when you detect this stuff, make sure it's in the middle of the gauze, not just in the packs. Yeah, so that's all the details. Make a decision why it's a good one or not. Also, it's more about the communication. We need to talk to our patients to make sure they are the correct patient, correct procedure, they are safe to have the contrast, they are happy to have the procedure, they understand what they are doing here. Also, we need to talk to our radiologists. We're gonna tell them when to start this scan. And we have different radiologists. We're gonna understand their different habits. They're gonna make both of us happy working together. Also, we have other radiographers. Anytime we have questions or we need help, just go outside, ask for help. We also have our nurses. They are the person, gonna help us to remove the catheter. That's all the people. It's a teamwork. It's not just yourself. You need to remember that always. And the final thing is practice. Practice makes perfect. Yeah. I think for me personally, if I do everything independently, I'm gonna learn better than observing that 10 times. For example, if I feel so confident to do, knee x-rays, chest x-rays, hip x-ray, because I already done that over 100 times since I started. It's the same like cystogram or other screening procedure, theater cases. If I do it every time I do it by myself, I'm gonna gain more confidence and make less mistakes next time. That's what I learned. So to conclude, we know that post-prostate surgical cystogram is important to help a surgeon to evaluate is there any leak on the bladder. It's a simple procedure, as I explained, but if you want to, it's not an easy one. If you want to reach a very perfect result, you have to concentrate all the details. You have to know how to work with people, how to work as a team. That's what I learned. And the most important, I realized the radiographers actually play the most important role in this cystogram. You are the controller. You can control, the pace of the whole cystogram. You are the bridge between the radiologist and the patient. If you want to be a real good radiographer, you just need more practice. That's all done. That's my presentation. That's the references. Thank you.
Thank you. That was excellent. I do have one question for you.
Yeah.
So most of this is based off males. I don't notice that you had a female diagram before, but like most of
It's
this,
males.
like prostatectomy
Yes.
and stuff like that,
Yeah.
they're all done on males. Females don't have prostates, right?
Yes.
So in the case of a female, another surgical induced reason why there could be a leak in the bladder, could you think of a surgery that a woman could have that would make her need a study like this?
Ureter? Maybe something wrong there. They have surgery around the area because they need the bladder as well. I'm pregnant.
Yeah. So if they have cesareans and stuff like that.
When they have pregnant,
sometimes they can nick the bladder because just everything's just squished in.
Yes.
There's another one that I can think of.
Yeah.
So kind of the opposite when people are done having all their babies. There's another surgery that women can have, which can also lead to the bladder being nicked. What would that potentially be? Do you know?
I don't know. Is Abby?
No. So once you're done having your babies and you don't need those things anymore.
Oh, you want to cease that, so you don't want pregnant anymore. You're gonna put something in your ureters, like
like a hysterectomy. Where they actually remove the uterus from the body because they sit so close. They can nick it in that surgery as well.
So even for female, they still need a
it's not as common, but it does happen.
Okay.
Yeah.
I haven't thinking about that.
No, that's okay. I just thought to see if you knew, but no, that was excellent. Good job.
Thank you.
Congrats.
Thank you.
I have one question too.
Yeah.
What is the biggest risk for this procedure, and is there any post-procedural care for the patient?
The biggest risk?
The biggest risk for the patient doing the procedure.
If they haven't had any contrast dye before, they might have allergy. Is that the thing?
Think about your equipment.
Yeah. Or if we do something wrong, we get the bacteria through the catheter. It's gonna.
The bacteria.
Yeah. they're gonna go through, into the catheter, into their body, and to get some infection straight away.
Yeah.
So it's very important to wear gloves. Make sure all the sterile part is real sterile.
So what would you suggest to the patient if they got an infection after the procedure? What would you do? What would you advise them before they left if they were to get an infection?
Go to see the doctor and have some, the doctor gonna give some medicine.
Just as long as they get it checked. But other than that, very good.
Congratulations.
Well done.
Thank you.